Myself, Dr. Asadullah Karigar, consultant cardiologist, diabetologist, and family physician, public. I am going to talk about the latest update in hypertension, starting from the WHO numerics which they have given. As per WHO, nearly 63% of total deaths in India are due to non-communicable diseases, of which 27% are attributed to cardiovascular disease, which affects 45% people in the 40 to 69 age group. Raised blood pressure is among the most important risk factors for cardiovascular diseases, and moreover, it remains poorly controlled due to low awareness about hypertension, lack of appropriate care through primary care, and poor follow up may result in this cardiovascular disease deaths. In India, the prevalence has also gone up over 30 years to 38% in men and 32% in women, from 29% and 28% respectively, as per WHO. Despite that, nearly half of the people, or 51% of the men and 41% of women with hypertension, were unaware of the condition. Additionally, over 62% of the men and more than 53% of women living with hypertension did not get treatment. Medication was used to control blood pressure in fewer than 1 in 5 men and 1 in 4 women with hypertension. International Society of Hypertension has released the 2020 Global Hypertension Practice Guidelines. The inclusion of optimal and essential treatment paradigms attempts to address the issue that in resource poor setting, optimal care reference to evidence-based standard of care, and whereas essential standard refer to minimum standards of care to allow specification of essential standards and care of low resource settings. American Heart Association has released a scientific statement in 2021 offering new guidelines for management of stage 1 hypertension among patients with low cardiovascular disease, atherosclerosis cardiovascular disease risk. Among low risk adults with stage 1 hypertension, management starts with the non-pharmacogenic therapy. If blood pressure remains uncontrolled at 3 to 6 months, consider starting pharmacogenic therapy. This is the protocol from Hypertension Association. Acute respiratory distress syndrome is a potential fatal condition involving lung damage, and experts often associate it with severe COVID-19. A recent study, which appears in the Journal of American College of Cardiology, reports that metoprolol can reduce lung inflammation and improve respiratory function in people with COVID-19 induced ARDS. Lowering systolic blood pressure targets down to the 110 to less than 130 mm of mercury range substantially reduced cardiovascular adverse events in the STEP randomized trial, affirming the findings for an order. Chinese population, among some 8,500 patients ages 60 to 80 in China, the intensive target trimmed 26% of opposite cardiovascular risk, finding from now a second major trial supporting a lower target could unite the guidelines, which even among US professional societies range from thresholds of 130 to 150 millimeters of mercury. With regard to prognostic value of ambulatory blood pressure monitoring and nighttime blood pressure, the 2018 European Guidelines on the Management of Arterial Hypertension recommended that the diagnosis of hypertension should not only be dependent on office BP measurements but also on the CV outcome. Thus, they may consider as the most relevant measures for estimating cardiovascular risk. Most patients with hypertension require lifelong medical therapy to achieve optimal BP control. The 2018 European Guidelines equally recommended 5 classes of antihypertensive drugs considering high non-adherence treatment. The importance of combination treatment is particularly highlighted to improve adherence to therapy and BP control. Therefore, the 2018 European Guidelines recommended especially the context of lower BP targets to start antihypertensive therapy with an initial dual fixed dose combination of ACE or ACE1 inhibitors or ARB plus CCB or diuretics. Since early July 2018, products containing valsartan have been recalled worldwide. The reason is the detection of a known carcinogen, namely N-nitroidomethylamine, which can be found in candesartan, irbesartan, losartan, olmesartan, and valsartan. NDMA has been classified by the WHO International Agency of Research on Cancer to be carcinogenic in humans if 1 lakh patients would have received NDMA contaminated valsartan from Hejiang Huahi, manufacturing site where the highest level of contaminants were found. Every day for 6 years in the highest dose, it could result in 22 additional liver cancers over the lifetime of these patients. The presence of NMDA in these drugs could lead to 8 additional cancer cases in 1 lakh patients if they had taken the highest daily dose over 4 years. Valsartan recall accompanied by significant increase in the rate of emergency department visits of +6%. Hygia study represents the largest study that tested 9-time antihypertensive treatment. In this trial, chronotherapy was associated with a significant reduction in endpoints, including death. The Hygia chronotherapy trial tested whether nighttime therapy in comparison to usual upon awakening hypertension therapy experts a favorable cardiovascular risk reduction. The largest study included a total number of 19,084 hypertensive patients during an average follow-up of 6.3 years. 1,752 patients experienced the primary cardiovascular outcome. An ambulatory BP measurement was performed for 48 hours to collect data on how BP differentiated during sleep. The reduction for cardiovascular events was significantly improved for nighttime treatment when compared with awakening treatment. So this was the recent updates in hypertension, and I suggest to take the regular hypertension drugs without skipping until the doctor's advice. Thank you.